We're here on the show floor at CPhI Worldwide, and I'm joined by Maureen and Andy from Cambridge Isotope Labs. Thank you very much indeed for joining us. Now, for anyone who is completely ignorant about what you do, and I must confess that includes me, just give me the 10,000-mile view of what Cambridge Isotope Labs does.
Cambridge Isotope Labs is the world's leading manufacturer of stable isotope labeled compounds and the leading separator of isotopes. We have 6 locations worldwide. 5 out of the 6 locations have GMP production capabilities. Every single location that we have, which we have 2 locations in Europe, 4 in North America, they all have milligram to kilogram scale production capabilities. And we, at this meeting here, we are interested in talking to customers about their needs for stable isotopes, which would be carbon-13, nitrogen-15, deuterium, oxygen-18 labeled compounds.
Now, you say you are a global company. Obviously, I'm picking up on the Cambridge Isotope Labs as a fully fledged Brit. I'm guessing that you're not the Cambridge in the UK, but you're the Cambridge over in New England.
The Cambridge in Boston. We were founded in 1981 by Dr. Joel Bradley, who is an organic synthetic chemist from MIT. So we started out across from the MIT Magnet Lab, and we were there for a couple years, and then over the last 36 years, we've relocated as we needed to expand our facilities. Right now in Massachusetts, we have our headquarters in Tewksbury, and then in Andover, Massachusetts is our main production laboratory.
It does sound as though all of these places are from the UK. I've been to New England as well, so I know that. But however, you are from the UK, yet you've made the move to New England. What's your role over there, Andy?
So at the moment, I'm a consultant for Cambridge Isotope Laboratories. I worked in the industry for the last 25 years. The last 10 of those, I worked for a company based in Boston called Concert Pharmaceuticals, who develop deuterated molecules for treatment of diseases. And so I've been working with Cambridge Isotope Laboratories for the past 10 years very closely as a vendor in the first instance. And more recently, I've helped them with some consulting work.
So what are the main conversations, Maureen, that you're looking at having with visitors to CPhI Worldwide this year?
Okay. Well, as Andy mentioned, his involvement at Concert in the deuterated drug market, and that's become an increasingly important market for us. And we want to talk to customers about their needs for deuterated APIs and starting materials. And I want to share with them what the CIL capabilities are in that market. We have a significant list of deuterated intermediates, deuterated solvents that people are using for manufacturing. We have something very unique to offer to this market. At our isotope separation facility in Ohio, we have the only commercial deuterium re-enrichment facility. We currently take back used D2O and we can re-enrich it. And currently we have a capacity to process 20 tons a year. We're expanding that to be 50 tons a year. And I think it puts us in a unique position to help with the costs of doing a lot of these syntheses, knowing that we have that ability.
Always terrific to hear firms going on such a scale of growth. Tell me, is this the first time that you've been to a CPhI event?
It's my first time at the international meeting. I actually just came in from from Vienna, from another meeting, and usually I have a conflict. But my team has come to this meeting for several years, and I have been to the US CPhI.
So what's the value? I assume this isn't your first time at CPhI either.
I'm a regular visitor to CPhI, usually on the other side. Where I'm looking for companies to do business with. But this year I'm here helping CIL, hoping to be able to explain to potential customers the value of working with CIL above other companies in this market. They truly are the leader in this area. We've worked with them for 10 years. We've been incredibly impressed with their abilities, both from a technical point of view and from a customer service point of view. Some of the work that we've done with them over the years has really helped to bring the cost of deuterated molecules down into an area that's acceptable. Deuterium is intrinsically very expensive, and the program that Maureen described where we can recycle and re-enrich the deuterium is a huge advantage in terms of cost of goods.
Before we go, Maureen, in a sentence, if you'll humour me, just tell me what you're most looking forward to here at CPhI Worldwide this week.
What I'm most looking to hear is customers' requirements. Currently we're making product milligram to ton scale. And as we've seen the needs increasing quite a bit in this market, we are planning right now to undertake a significant expansion at our isotope separation facility. We just purchased 20 acres, and the main reason behind that purchase is to set up a new building, larger scale reactors. So we want to find out what the needs are so we can plan accordingly to make sure that we can take care of customer needs. And the other aspect too, as Andy touched on a little bit, I think a real strength that we bring to this market is we have over 36 years of technical expertise in the production and analysis of deuterated molecules and stable isotopes. And as people have been pursuing the deuterated molecules for the deuterated drug market, there are some nuances in both regards of deuterium exchange on some of the syntheses or some enrichment issues. And I want to find out, how can we help our customers? How can we put them in contact with our senior chemists to solve their needs?
It's a very long sentence, but I'm going to summarise that. No, that's fine. I'll summarise that, I guess, as saying that this is a place where you can hear from your customers and get their requirements.
Absolutely. That's what we want.
Good stuff. Well, listen, Andy, Maureen, thank you very much indeed for joining us today. I wish you all the very best for the rest of CPhI Worldwide this year. Thank you.
Thank you. Thank you.